Okay, so what we're going to talk about today are basically two things: central lines, and then the external urinary devices and Foley catheters. So just make sure that if you have a PICC line in, that it meets the criteria for a line or any other type central line. And if it doesn't, then make sure that your physician knows, hey, maybe we need to go to maybe a midline or take that line out. So the reasons why you would need to change that are, of course, if you see blood, if it is to where it's starting to peel or come undone, or if you can't actually see where the line is inserted. So just remember, don't ever reinforce your dressing. Make sure that you're changing it. We change them here at our facility every 7 days, usually on a Wednesday, unless it meets one of these criteria. Another thing about your lines, even if you have a PICC line or any type of central line or a peripheral line, we now ask that you put a swab cap on all of those insertion points. So central line or peripheral line, everything needs a swab cap, okay? This is the new central line dressing change kit. Just wanted y'all to be aware of that. And if you see this, then you know exactly what that is. Also, just remember, if a person has a central line, we also do a CHG bath every day. This is the methodology of how you do your CHG bathing. Every one of the cloths has a matching part of the body that it needs to go to. If your patient is allergic to CHG, you can just do a standard soap and water bath. But please remember to try to use this particular methodology in doing your bathing. Okay? All right. Just wanted to show you an example of the dressings. This is going to be a dressing for a central line or a PICC line. This will be a dressing if your patient has a metaport. Okay, so just a little bit of difference, and we wanted to show you the difference in the two dressings. Okay, changing to another subject that we want you to be aware of is blood culture collection. The laboratory is now sending up a device or little kits that have a throwaway or a discard tube in it. So you're going to draw up into the tube, you're going to discard that, and then you're going to draw your blood culture. This will be an example if you're using a butterfly. This is an example if you're using a syringe. So if you have blood cultures ×2, you're going to draw up a syringe and discard, then get your blood culture, go to your next site, draw, discard, and then draw your blood culture. Okay?
One question on the blood culture discard. I was instructed that we actually put a label on it and send it to the lab so that they can verify we use the correct process.
Okay.
Is that your instruction as well?
Yes. Yes.
Okay, perfect.
Okay. All right. Switching gears now to a Foley. Just remember, we do have criteria for an individual to have a Foley. If they do not meet that criteria, then maybe we can take that Foley out and put an external urinary device. These are not catheters. These are external urinary devices. On the male, the first time you apply, please use the clear package. It has the initial daisy application, and then it has 2 packages that you definitely need to use to clean the individual before you put and apply the daisy or the men's external, okay? After that, the very first application, it's gonna last between 4 and 6 hours, and the reason why is because it's wicking. It's gonna wick the moisture, and it'll only adhere for about 4 to 6 hours. After that, we're going to go ahead and get the blue package, and we'll do another application. This application on the male should last for about 10 to 12 hours, and you'll know when you need to start changing it, if it starts unadhering or if it starts turning yellow. The third application for the male should last about 20 to 22, 24 hours. The male can get up and walk. Because remember, on these they're attached to the leg, to a bag, and you can just make sure that you get the bag adhered to the leg, and then the patient can go down the hallway and come back to their room. This does not go to suction. Please do not adhere or hook this up to suction. Now the female, this is a female. It's a external urinary device. This is called the PureWick. This kind of fits in, kind of like sausage in a bun or hot dog in a bun. This is not for all individuals. The larger the female, this has a tendency to adhere or to be used and adhere, not really adhere, but to stay in place better than on your smaller individuals. Not saying that your smaller patients cannot utilize one of these, but if you do this, use this on a smaller individual, please, one of the things that you might want to use to keep this in place on a smaller individual are your mesh panties. And those should be in your Walmarts. Again, these are not for everybody. If they move a lot or if they pick, this is not something that you might be able to use for your patient. This one does go to suction. Please do not set your suction more than 40. We started having some issues with people setting it to 60 and 80, and we're getting skin breakdowns on our females. So please, 30 to 40 on your suction, and that's all that you need to use. This can be set aside. If your patient wants to ambulate down the hallway, you can turn your suction off, remove this, lay it on a clean environment, cover it with something that will not allow it to get anything on it. Your female can go and walk down the hallway or go outside, whatever she's allowed to do. When the patient comes back, if it doesn't need changing, then you can go ahead and gather it, reapply it, and then start your suction back. If it does need to be changed, then this is the opportunity to change it. Okay. Suction, no suction. Any questions? You're more than glad to call infection prevention, and we will help you guide with any questions that you have.
Thank you.